Hi guys, welcome back to another episode of On Topic with Dr. Lisa. Today I'll be talking about common orthodontic emergencies. So when everyone gets their braces put on, generally the teeth are crooked, right? So because the teeth are crooked, we have to put in a thin, flexible wire. So that means that it's going to be flexible even when you're eating. So it's pretty common when you're chewing with your back teeth, if you're chewing something a little bit firm or too hard, you can actually push the wire out of the last one of your braces. The last bracket in your mouth is typically a tube, so the wire can be pushed down and out of it if you bite into something a little bit more firm. So when the wire is out of the tube, the good thing is that you can actually put it back in most instances yourself. So you can try to do this by taking some tweezers. Please clean them off first. Take the tweezers, hold the wire, and push it back into the tube. If you're not able to do this, leaving the wire out of that last tooth is not a big deal as far as making sure that our treatment is progressing in a timely manner. So if it's bothering you, poking you, then you can actually cut it yourself or come into the office to have it cut. Since you don't have these instruments at home, a nail clipper will be able to get right up there near the end of the last bracket that is tied in. If your wire is poking at the end of the last bracket, you can use some nail clippers to clip it as close to there as possible. If not, just smush some wax on there, or you can call in to let us clip it. We'll clip it right up against the last tooth, and then you'll be much more comfortable. This is only possible with those really thin, flexible wires that are used typically in the beginning of treatment. Once again, get out your alcohol and clean off a pair of nail clippers. These nail clippers might be able to get the wire for you. If it's very long, you'll be able to use the clippers to clip it shorter and hopefully get yourself out of discomfort. In the meantime, when you're having some discomfort, if you're not able to clip it yourself successfully, you can use wax. To use wax, you just swallow, make sure there's not a pool of saliva, and take a little piece of wax, ball it up, and smush it on the area that's bothering you. Using orthodontic wax is helpful not just for long poking wires, but for any of the braces or other areas of your mouth that's causing any irritation to your lips and cheeks. A wire also might become long and poking because that wire is so thin and flexible, it can all slide around your mouth to one end as your teeth are getting straighter or as they're brushing. It's also common for the wire to get long in the back when you're closing spaces. This is nothing to be concerned about. Just make sure that you bring it to the attention of the assistant or of the orthodontist so that they can trim your wire before you leave your adjustment appointment. And once again, it's pretty normal to have some length of wire develop and slide around and things are changing in between your adjustment appointments. So we've covered what to do if a wire comes out of the last tube and if the wire is long and poking. Another common orthodontic emergency is having one of your braces fall off. If one of your braces falls off, it means that tooth is not moving for the length of time that it doesn't have a bracket on. That being said, orthodontic treatment typically takes place over the course of several months to several years, so having a bracket off for 2 weeks is really not a big deal in the grand scheme of things. So that's the good news, but still, when one of your braces comes off, it might cause some irritation and some pain, particularly if it's that last bracket leaving you with a long wire. In between appointments, if that last bracket comes off and you can't clip the wire yourself, come in for an emergency appointment and we'll clip the wire for you to make you comfortable. We will typically do a bracket repair at your next adjustment. When you do notice that you have a bracket off, please call our office. You can find the contact information on the website and let us know that we have a repair to do so we can dedicate a little bit more time to doing so. If you notice that one of your braces comes off that's not the last bracket, usually this situation is not as painful, but you still want to let the front office know that it has happened. Then it'll be up to us to decide, okay, if your adjustment's in a week or 2, that's fine, we'll repair it at that appointment, or if your adjustment is further out, then we'll schedule you for a special emergency appointment. The best way to prevent the emergencies mentioned so far is making sure that you're eating food that's soft, not hard, sticky, or crunchy, and you're following all of our eating and brushing guidelines. There is another situation that might cause some discomfort along your orthodontic journey, and that would be poking steel ties. So what are steel ties? They are these little metal wires that hold the main arch wire into the braces more firmly than the collars do. So these are usually put on particularly twisted or stubborn teeth. When you put the steel tie on, it has a little tail. Your assistant or I will tuck in that tail to make sure that the tail is not poking you. Make sure to let us know before you leave if it is. However, in normal brushing and flossing, it's easy to dislodge that tail and push it out a little bit so it is catching your lip, cheek, or tongue. If that's the case, you can usually fix this yourself. Take the end of a pencil eraser and use that to push it up against the steel tie. That will be able to tuck it underneath the bracket and get it out of the way of your lip. An eraser is the best thing to use because it doesn't get caught itself on the tail, but you can also try using a Q-tip if you don't have an eraser around. And if all else fails, use some wax. Another potential issue that can occur is with separators. If you plan to have bands or an appliance that has bands on it, such as an expander, put in at your next visit, at your current visit you would have separators put in to make room for those bands. The separators are little rubber donuts that are put in between the teeth to make room for the bands to fit around the teeth. These separators can come out if you eat something really hard, sticky, crunchy, or chewy, so if you notice that it does come out, please call us and let us know. We will try to replace the separators for you before your scheduled appointment for the delivery or fitting of the bands or appliance. That way, we'll make sure that we have enough room to push the band down around the teeth. You can actually also have orthodontic emergencies when you're in clear aligner treatment. The attachments that are bonded to your teeth that help your teeth move as planned can come off if you eat something that's too hard or sticky. If that happens, just call us, let us know, and we'll schedule an appointment to put that attachment back on as soon as possible. If that does happen, there's nothing you can do at home to replace it. Just make sure that you do not move forward with the next aligner until that attachment is repaired. There are other more rare, complicated orthodontic emergencies that can happen when you have some appliances in. If you have one of these appliances, we will let you know about what the potential emergencies might be. And that about covers all the most common orthodontic emergencies. If you have any questions or if you're having an orthodontic emergency now, give our office a call at 813-336-8889. If there's something else you want to hear me talk about, please email me at ontopic@origamiorthodontics.com. Thanks again for watching, guys. Bye!